I will stand up and be counted for UHC.
I will stand up and be counted for UHC.
I will stand up and be counted with UHC.
Universal health coverage is all about ensuring that all citizens in this country have access to high quality health care without having to go into poverty because of high health care spending. This means nobody should ever have to suffer because of high medical bills. Professionals in this nation are key. By definition, a professional is someone who has the right knowledge. Knowledge always translates to power, but it's not enough to just have that power. You need to wield that power. So how do you wield that power? We wield this power by keeping the systems accountable. It is important that professionals in this nation rise up and realize that healthcare is everybody's business. It is not just the business of the healthcare workers who are working in the system right now. Systems are meant to work for people, not people for systems. Therefore, it's important that we use the knowledge that we have and the experience to take the message about universal healthcare out there. Let us get into the conversation. Let us get on board and have our communities know what it is to have universal health coverage. Let us take up leadership and lead our communities into financial risk protection and access to high quality healthcare. Everybody has a right to good health. Everybody has a right to access good health care. Everybody has a right to be protected from financial catastrophic expenditure due to medical bills. Therefore, let us stand and be counted for UHC in Kenya.
As a pharmacist, I'm going to talk about access today in terms of the two dimensions of access, where there is the having access to, which deals with the coverage of the infrastructure we have, and the gaining of access, where we talk about the patient actually getting value from our health facilities. In the pharmaceutical sector, the most important thing that we can do in this conversation about UHC is to reduce cost on the part of the patient. That would mean bringing down the out-of-pocket expenditure, and that would also translate to having affordable and cheap medicines. But when we talk about affordability, we also bring in the issue of quality, and so in that regard, we would recommend that when we do our strategic purchasing, we actually come up with national lists of essential medicines, and more so as now that Kenya is a devolved country and we have 47 counties. The other strategy we could use is the strategy of pooled procurement, and in that regard we would use economies of scale to actually reduce on the costs of medicines.
It is important to note that as nurses working in hospitals, most of the time you are the advocates of the patient. And the most important thing is when a customer comes, what do they expect as we talk of universal health coverage? One, and the most important, customers come for services, and that is our duty number one. And when they come, they expect that these services will be provided quality and in a timely manner. And therefore, as a customer advocate, I would want to urge all health workers, all facilities in this country, that we need to up our game and we need to provide quality and timely services to our customer. The other thing is, customers when they come to our hospitals, we've been having a big challenge whereby each and every hospital they go, they open a new file. In this front, we want to call on innovation that our customers can be able to access their health care, their health records wherever and anywhere they go, so that access of their services become easy, becomes timely, and they are given the right services they deserve. The other thing is very, very important for them to access the healthcare. That the healthcare industry also need to innovate and move toward customer-centric services. We've seen over and over again, whenever customers seek services, they are not given the right services, they are exploited, they are given additional services which were not necessary. But as customer advocates, and in line with this universal health coverage, we need to reduce the cost, we need to be very customer-centric, and we need to provide the services that the customers need in a timely and a quality manner. As also healthcare and customer advocate in our hospitals, we also know there is a lot of bureaucracies. We need to reduce on this so that customers can also access their services in a timely manner. We are talking of universal health coverage where access is guaranteed, where customers get value for their money, because ultimately we understand that in all this somebody is paying the money, and therefore customers deserve to get what they have paid for, and it is very, very key. We also need to avoid unnecessary tests which have been offered time and again. We also know that customers have also been kept in hospitals over long period of times so that health providers can exploit and get additional money. And therefore we are saying, as customer advocates and also in this universal health coverage, that we also need to get our policies right so that when customers present themselves in these health facilities, they get what they deserve, they get services that are very, very necessary, and therefore even the money that is there, it's shared equally and equitably.
For the health workers, you've heard so much about UHC, but it's important for you to understand that by some stroke of luck, UHC is now a political issue, which means we have political goodwill and you are the implementers. So as implementers, you must arm yourself with knowledge, you must read, you must understand what UHC is about. You must understand that as implementers, there'll be so many people saying so many things, some right, some wrong, but you know what the people need. So you need to arm yourself, you need to read so that you can say this is right, this is wrong, not just for the patient, for you also as a health worker. And in addition, you need to understand that even as you arm yourself, there will be changes with UHC. It will mean the way you work, the timings and the locations will change. It means task shifting, it means just more dedication from your part. It means innovation on your part, and so you must understand that change is coming, and you must ask yourself, are you willing, are you ready to stand and be counted in UHC?
When we talk about equality, we are talking about equality in service provision. This means that all Kenyans, regardless of gender, tribe, political affiliation, religious background, and economic status are able to access quality healthcare based on need. This is enshrined in our constitution, and this is a basic human right. So when we talk about universal health coverage, what we are asking ourselves, is it going to cover all Kenyans, regardless of where they come from, who they are, and also their ability to pay? This is the question that we need to be asking ourselves as we push for this agenda. My fellow Kenyans, stand to be counted. I know I am.
In our country, Kenya, we have been, of course, implementing universal health coverage since independence, but using different strategies. But during this period, we are now lucky that we have the strongest political will that we have not had, and this brings up the priority of healthcare in our country almost to the top, especially being among the big four agenda for the president. And I'm happy to note that indeed it has gotten a lot of support even from the Council of Governors, who indeed really look forward to its implementation. However, there are three very important things that if this has to succeed. One of them is having enough human resources, having, of course, adequate or optimal financing, and importantly, access to the right medicines and supplies. I will zero in on human resources for health. These, of course, are technical experts in the delivery of this important service, and it can only be achieved if there is proper leadership and governance in this area. Of course, we appreciate that we now have optimal political leadership, but we do require technical leadership to be able to create a conducive environment for the delivery of this UHC. And with this would mean that our technical managers, they have to transform themselves into skilled technical leaders to be able to inspire our health workers to have a paradigm shift in terms of how they have delivered health services in the past, so that we can be in this state of mind that focuses on the patient in terms of the patient accessing quality, affordable healthcare services that do not push them into poverty. And this will require many of us healthcare managers to undergo, if necessary, short managerial courses, especially in how to focus on the patient. And this will require a focus, identification of the necessary stewardship that we must be able to provide. And it is important also to note that we must be able to take advantage of the political goodwill environment that has been created, given that this is the first time in the history of this country we are having this very strong commitment from our political leaders about the delivery of quality healthcare services, so that then we can now begin to walk the journey towards the attainment of UHC.
Healthcare professionals are key to achieving universal healthcare in Kenya. Remember, we are here for the patients. The patient is all. We need to move towards a more patient-centered kind of healthcare. It's not about the hospital working for you. It's about the hospital working for the patient. Let us remember our oath. Let us remember our obligation. And it is to offer high-quality services to any patient who walks through our door. In order for us to play our role in universal healthcare, we need to become more patient-centered.
I will stand up and be counted for UHC.
I will stand up and be counted for UHC.
I will stand and be counted for UHC.